Okay, this is an overview of the wireman arteries. So remember, when looking at this wireman, it is in anatomical position with the palms facing forward. The arteries are on the left and the veins are on the right. The basic organs here are the heart, the liver with the diaphragm separating, the gallbladder, the spleen, the left kidney, and the right kidney. Now, starting at the heart, we'll look at the arteries. So here's the ascending aorta, and at the arch we have three major branches: the brachiocephalic artery, and then that branches into the right subclavian artery, the right common carotid artery. The second major branch is the, if you can see here, the left common carotid artery. And if we follow that up, we reach the external carotid artery that goes out towards the face, and then the internal carotid artery that goes in towards the brain. You have a matching one of these also on the right side. So if you continue along the aortic arch, the third major branch is the left subclavian, and we'll follow that down the left arm. So the left subclavian turns into the left auxiliary, into the left brachial. Then on the most lateral side, it becomes the left radial. The most medial is the left ulnar, then the palmar arch, and then the digital arteries of the fingers. Okay. So if we turn this on the side, you can see here that the aorta descends down behind the heart, and this is considered the thoracic aorta. These arteries coming out from the thoracic aorta are the intercostal arteries that go to the ribs. Then as we pass through the diaphragm, which is this blue structure here, it becomes the abdominal aorta, right here. The first major trunk that comes off the abdominal aorta is the celiac trunk, and it has three branches. The first is the splenic artery that goes to the spleen, the gastric artery that goes out towards the stomach. It's the small one that sort of circles out towards you. And then the hepatic artery that goes to the liver. So again, the celiac trunk is the first major branch out of the abdominal aorta and has three branches itself. The first to the spleen, the splenic artery. The second, the gastric artery that circles the stomach. And then the third, the hepatic artery that goes to the liver. The next major branch is the superior mesenteric artery that goes to the small and large intestine. So the superior mesenteric artery. The next one off the abdominal aorta is the left and right renal arteries. So here's the left renal artery. And then on this side, you can see the right renal artery. Immediately after that, you have the gonadal arteries, and they're very small, almost like dental floss, that go down to the ovaries and testes. So these are the gonadal arteries, this very small red one right here, and then you have another one right here. They go down to the ovaries and the testes. And then finally you have the, right here, the inferior mesenteric artery that goes to the large intestine. Okay. Continuing down the abdominal aorta, you come to the common iliac artery, and then it splits into the external iliac artery, the left and the right external iliac artery, and then the internal iliac artery, left and the right. So if we follow the external iliac artery down, it becomes the femoral artery, and then the popliteal artery at the knee, and then out towards the front, the most anterior is the anterior tibial artery, and then at the back, arteries posterior. The one most medial is the posterior tibial artery, and then the one most lateral is the fibular artery. If we follow the anterior tibial artery down, becomes the dorsal pedis, and then the digital arteries of the toes. It's also important to remember that whenever you see the word common, like here at the common iliac, that it's going to split then. So like it did at the internal and external iliac arteries. So whenever you see the word common, that means that it's about to split, like here at the external and internal iliac arteries. So remember that not like here on the wireman, but in real life you do have arteries not only on the left side but also on the right side of your body. Okay, that concludes our overview of the wireman. So this is a continuation from the wireman arteries. This is a superior view of the brain. Here are the vertebral arteries as they come up from the neck through the foramen magnum. The right and the left vertebral arteries. The basilar artery, right here. The right and left posterior cerebral arteries. The right and left posterior communicating arteries. The right and left internal carotid arteries. The right and left anterior cerebral arteries, and the anterior communicating artery. Together they make the circle of Willis, or the arterial circle. So again, the right and left vertebral arteries as they come up from the neck through the foramen magnum, the basilar artery, the right and left posterior cerebral artery, the right and left posterior communicating artery, the right and left internal carotid artery, the right and left anterior cerebral artery, and the anterior communicating artery. And then together they make the circle of Willis. These arteries actually help equalize blood pressure within the brain. Okay. This is a view of the arteries on an abdominal plaque. As the aorta descends through the abdominal pelvic cavity, the first major branch is the celiac trunk. As you know, it actually branches 3 times. You can't see them here, but there would be a branch to the spleen, and then around the stomach, the gastric artery, and then the hepatic artery as well. So here's the celiac trunk. The next one down on the abdominal aorta would be the superior mesenteric artery, which goes to the small and large intestine. The next one would be the left and right renal arteries. You can't see the left one here because it's behind, but it goes to the left kidney. So these are the left renal artery and then the right renal artery, followed by the left and right gonadal arteries that go to the ovaries and testes, and then the inferior mesenteric artery that goes to the large intestine. As we continue down the abdominal aorta, we come to the common iliac, and then they branch into the external, right and left external iliacs, and then the internal, the left, and then the right internal iliacs. So again, from the abdominal plaque view, the celiac trunk, the superior mesenteric artery, the left and the right renal arteries, the gonadal arteries, and the inferior mesenteric arteries. Then the common iliac, the left and the right external iliacs, and then the internal iliacs. And that concludes the view of the arteries from the abdominal plaque.